Hello, Cook County. This is Dr. Farchmin from the Sawtooth Mountain Clinic. This is part two of a three-part series. I just wanted to get out to give an update to the community about an update about the COVID-19 illness and to get some accurate information out there. There's a lot of information. There's some misinformation, and just wanted to get us all on the same page. It's been a while since we've done videos to update the community. So. In the first part, we talked about why COVID-19 is a big deal. And so now I just want to share a little bit more about what we've learned about this virus. So the most common symptoms throughout this whole thing have been fever, cough, shortness of breath, and body aches. Basically, pretty much just like influenza. Unfortunately, after about a week and a half or so, though, it gets to be much worse for some people, especially those over age 65. However, this virus has been a very frustrating one to work with from the medical side because it has shown that it can look like anything and nothing. So we've added sore throat, cold symptoms, nausea, diarrhea, and oddly enough, some things like loss of smell and or taste without much in the way of sinus symptoms. And then we know that other people really have no symptoms at all. And so this has become something that can look like anything, which makes it difficult to deal with in the healthcare facility. However, most people still get those influenza symptoms with fever, cough, shortness of breath. Lovely picture here of a gentleman coughing, and you can see those droplets coming out. Those are big droplets, but when we talk about droplets, we're also talking about ones that are fairly big in the microbiology realm, but that you can't necessarily see. And we know that if someone's around coughing, that can be in the air in the short range around them and get other people sick. We also know that the virus will show up on objects, but as we've watched how this spreads, it does not seem that touching an object that somebody sick has touched is a major source of infection, which is good. It opens up a number of things, which I'll talk about later. So we know it survives on surfaces, but the main thing that we know absolutely is that it spreads in droplets. So if you're within 3 to 6 feet of somebody who's coughing and sneezing, that is a high risk area where those droplets can be having an effect. The big question and a major debate in the medical community still is whether this is airborne. And it's not a clear-cut black and white. Airborne just means smaller droplets that can get farther away. We know that measles is a very contagious airborne illness. That's something where if you're just in a room with someone who has measles and you're not vaccinated, you can get sick very quickly, and a large number of people get sick. We know it's not as contagious as that, which some would argue means it's not airborne. However, we have seen instances where it's spreading in call centers where a lot of people are talking on the phone and people far away from the sick person have gotten sick. There's been instances in restaurants where people sitting at tables far apart have gotten sick. Day camps where people are sleeping in the same room, and also choir practices where a lot of people got sick. The data is still preliminary. We haven't nailed it down 100%, but there's evidence for both. But we know that droplets are a part, but there's some concern that airborne can take a role here. You can see on the chart or on the picture there below, certain things like Ebola, it's a droplet thing. It stays short. Measles, further out. We think that COVID may be somewhere in between. And so that's what we know about that. There's going to be more data coming. But the bottom line with what we understand about how it spreads is we know that the highest risk areas are being around infectious people. Closed spaces, even if you're 6 feet apart, but if you're in a small room for a long period of time, that can be a high risk situation. Being within 6 feet, we know is highest risk. And time is a big thing, being there for 15 minutes or more. It's not just, it takes more than one virus to get somebody infected, so you have to be exposed to enough of the virus, and so time definitely seems to be a part of this. So when does it spread? It seems that somebody, when they're getting sick, can be spreading it for 2 days before they even know they have symptoms. There seem to be most infectious somewhere between the day before to a couple days after they get symptoms. And that lead time is why this has spread and been so difficult to get ahead of. So by the time you're at 10 days out, you're really not that infectious. Some people who get really sick and end up in the hospital are infectious longer, but at 10 days, even though some people may be coughing, they're really not that infectious. So, so for the people who never get symptoms, we just don't know right now if they're spreading this around. That's an area of ongoing study. So this is another slide that brings it down locally. This virus affects different people of different ages in different ways. So these numbers are directly from the Minnesota Department of Health website about coronavirus as of today. And they do a nice job of just putting the data out there. I've added the percent on the right column just to make it a little more clear. But you can see in the young people under 50 years old have a very low death rate from this. It really does not cause them to die. Now, that doesn't mean some people don't die. You can see the numbers there. Some people do get very sick. Maybe they don't die, but they're in the hospital. But the mortality rate is really low. But as soon as you get up higher, you're looking at over 60, the percents get much higher. And so that's where that number you hear spread around of 1% mortality is somewhat misleading. It depends on who you are. These are our Minnesota numbers. This is us. And so certainly in each age group, people who have more medical issues have a higher chance of dying from this, but this is all comers. And so these are the real data that we know here in Minnesota. So this was part 2 of a 3-part series. I've got one more coming, and thank you for listening. And I hope to talk to you soon and just share some good and accurate information on what we know and don't know about COVID-19. Thank you.